So, good afternoon, everyone. Good afternoon, sir. My name is Rory Gallarino, and I am from BSN to B30. And today we're going to perform the perineal care procedure. So, first things first is the first step is to identify the patient, introduce myself to the patient, and explain the procedure. So, good afternoon, ma'am. My name is Rory. University of Perineal, so I have divorced. So, may I have your name please? And if I may, I would like to confirm your name to your So, next is I'm going to explain the procedure to you. So, basically, what we're going to do is we're going to clean your perineal area using all these products like the iodine solution, silicone, and the soap sponges. And the purpose of this is for us to, of course, clean our perineal area and for us to prevent the spread of infection. So, before that, I would like to gain consent before I do the procedure. So, next is I'm going to prepare the sponges and materials that we'll be using. So, in this procedure, we'll be using 6 sponges, and I'll be soaking it into an antiseptic solution, the iodine solution. So, here I'm going to use the picking forceps. So, let's use 6. After this, is you're going to position the patient in a Italy position. Let's just assume that our patient is in a Italy position. And then next is I'm going to wash my hands. And then I'll do hand care as well. And after this is we're going to apply sterile gloves.
While your baby is live reach under them their back and so then after that is take a soapy lather with washing up or with hands. Then start with the neck up and down to the baby's entire body. Then make sure you be first between fingers, toes, next is keep the baby out of
After this is I'm now going to start with that procedure. So what we're going to do is we're going to take a sponge, a soap sponge, and then it is important to take note that when applying the sponge, we need to apply it in one area only, and make sure that we are not applying a used sponge to the clean area. So we're gonna start now. So first is we're going to, using a zigzag motion, we're going to clean from the clitoris towards the lower abdomen, and make sure that we're not going beyond the pubic hairline. And then put it in the proper scissors and rifle. And after that is we're going to one. And Again, follow the zigzag motion from the inner thigh here in the labia towards or between the patient's hips and knees. So again, let's follow the standard procedure of the zigzag motion. And put it in the proper waist placenta. Then do or repeat the same procedure at the other thigh. And then next is we are going to apply another soap sponge to these area here. The area in the clitoris, then down to the perineal, then down to the vulva perineal, and then the anus. It's important to take note that when cleaning this area, that we need to do a menstrual because it's not good to use the same sponges. And then put it in the proper. Repeat the same procedure or the same step in the other side. So from and then next is we are going to clean from the middle part, here in the middle part, from the clitoris down to the vulva and then down to the perineal. Take note not to touch the anus. Then put it in the proper receptacle. Now that we are done with the power procedure, I'm now going to remove my gloves. And then do proper hand washing or hand hygiene. And then we're going to provide the patient with aftercare and privacy.
Question, if a patient refuse, then for example, the patient conscious pa, refuse siya, mauwaw siya.
Once find alternatives yung pwede sila ang bukas na procedure or pwede nga significant others and I will be there to guide.
Do we need to have consent for this procedure?
Yes, sir, it's very important to receive the consent of the patient as part of their
If unconscious ang patient, but unconscious siya, pa-consent po ba?
Cancer, following the doctor's order and or kanang sa significant others sa mga patient.
Pero usually, kaya yung mga procedure, no need na gano'n siya consent, kaya hindi siya mga invasive na procedure, pero no. But usually, basta natin, usually asam nga setting, hindi sa ICU. Di ba? Sa ICU ang setting, may mo gito mag-perineal care, may gito sa patient. Usually, ang ka na mag-perineal care na either after shift, before my animal shift, I mean, especially kung mag-sleep ulit siya kanagin, mag-bipal, mag-sleep sige ko ano na mag-limpyo-limpyo din kung ma-ICU ka kapoy ko siya, mag-sleep ka, mag-touring schedule pa, may lahat na. Pero anyway, ato perineal care mo ito, so okay.